and get going. As I've been introduced, I'm Taylor Bostwick from the Speech and Hearing Center, but this presentation is not about me. So I'm going to go ahead and dive into where I work, which is the important part. After this session, I hope that you will better understand the vital role that the Speech and Hearing Center plays in lowering barriers to healthcare access and reducing health disparities in the community, as well as how you can support our mission. So I wanted to start with the basics, who we are. We're the only nonprofit medical practice of our kind in the area. We are based on a national model, though. We're members of the American Speech Language Hearing Association, or ASHA, as we refer to it, and the National Association of Speech and Hearing Centers. So there are centers like us across the country. Where we are, this is a question I get a lot, so I always include this in introductory talks. We are on Highway 153 at Shalford Road, right behind the post office. Very visible from the road, kind of a weird access road to get to us once you get off of the highway, though. We also provide speech services at our satellite office, which is inside the First Presbyterian Church of Cleveland, so we can better serve those patients in Bradley County. Our services are offered at our clinic, as well as off-site at local schools, manufacturers, hospitals, and adult daycare centers. We provide audiology, speech, occupational, and physical therapy services, and we have a dual focus on early intervention, which is birth to 5, and older adults, age 65 plus. So we have many different services for many different people of all ages under one roof. We ensure all individuals with speech, hearing, or developmental impairments have access to the services and equipment they need, regardless of their ability to pay. And I like to say we're there for first steps, first words, and for the first time people hear in decades. So branching off of that, audiology is a big piece of what we do. We have a licensed audiologist on staff who cares about patients' long-term hearing health. So that's different from having an audiology assistant, hearing screener, hearing aid specialist, or hearing aid dispenser, which you might find at other clinics. Our work begins with a child's first breath, as newborn hearing screenings are an essential piece of the puzzle. We perform more than 2,000 annually. And congenital hearing loss is one of the most common birth abnormalities and affects between 1 and 3 babies per 1,000 born. Beyond newborn screenings, we offer full diagnostic hearing evaluations for children 5 and up. We skip between newborn and 5 years old, as we do not have a pediatric audiologist on staff, and that is a specialty. Oops, I skipped forward. Sorry about that. The only real treatment for hearing loss is a hearing aid. Therefore, we sell, fit, maintain, and repair hearing aids for our patients. Our audiologist puts in the work to ensure patients are adapting to their hearing devices and that those devices are fine-tuned and being used and maintained properly. We provide a quality of care and follow-up that you may not find elsewhere. We also protect the hearing of local manufacturers' employees. OSHA mandates that manufacturing facilities that have a certain decibel level of sound inside of their facility perform annual testing on employees to ensure that their hearing is not being affected by their work. So we have a mobile unit that travels in a 250-mile radius from our center to provide on-site hearing conservation testing for those facilities. So our audiology services really do run the gamut. And then the other side of our model is therapy. So we're full service, as many children who need one therapy need others. More than half of our therapy patients have multiple diagnoses. I've listed here some of the common conditions we see in our therapy patients. So we offer comprehensive speech language pathology evaluations and ongoing therapy for all ages. And then we offer comprehensive pediatric physical and occupational therapy evaluations and ongoing therapy. Our approach is twofold. I told you we have that dual focus on early intervention and older adults, so let me dive into that a little further. Early intervention, simply put, is the earlier the better. So technically, it's defined as services to children birth to 5 who are considered vulnerable to the risk of disability or social economic disadvantage. Our staff help parents identify communication disorders and developmental delays at an early age, so children can get the necessary treatment to be successful in school and beyond. We refer to the appropriate services both at our center and those offered by other local professionals, like mental behavioral health assessments, ADD evaluations, ADOS evaluations for autism, etc. Communication disorders can have a devastating lifetime effect without early intervention, which is why it is central to the center's approach. There's evidence that quality early childhood intervention services for children with disabilities can have beneficial effects on their function, as well as on the adaptation of their families. These children may be able to be mainstreamed into classrooms with typically developing peers. This approach reduces the need for later treatment, improves the child's social emotional growth and self-esteem, helps with academic and literacy benchmark achievement, reduces the risk of negative alternatives, and reduces the lifetime cost of tax subsidy for an individual on disability. And early intervention doesn't only involve treatment for the child, but also education, support, and guidance for parents. Our therapists help fill that education gap. They connect patients and their parents to resources they may not otherwise know about to ensure that all families can advocate for and provide adequate care for their children with disabilities or complex medical needs. On the other side of that, we assist older adults in living fuller lives by addressing their underlying hearing loss. This in turn allows an increased number of older adults to remain active and independent through access to proper hearing health care. Through our audiology services, a greater portion of older adults are connected to resources for independence and social emotional fulfillment. Untreated hearing loss in the elderly manifests itself in a number of negative ways, including social isolation and increased risk of falls, dementia, and depression. So that's what we're fighting against. The American Speech Language Hearing Association reports that 5 to 10% of Americans have some form of communication disorder. This statistic means there has always been a great need for our services, but we've seen exponential growth since the start of the pandemic. We serve a large portion of children from Chattanooga's urban core, which, as we've heard in previous presentations today, has a poverty rate of 35%, and even worse, the child poverty rate in the urban core is 52%. Our patient population mirrors this extensive need, as half of our patients are below the federal poverty level. Research proves that children born into poverty are less likely to have prenatal care, more likely to be food and housing insecure, and less likely to have highly educated parents. This creates a direct link between low income and a higher risk of developmental delays, as well as a general lack of knowledge regarding warning signs and access to diagnostics and treatment. We often encounter children in disadvantaged situations whose parents do not have the knowledge or resources to know what to do or where to turn. And we are their earliest access point to identification and intervention. There are more than 21,000 children aged 0 to 5 in Hamilton County, and it's our belief they all need equal access to early identification. Because when children do not get the intervention they need, they are not kindergarten ready and may never catch up to their peers. This leads to plummeting societal literacy rates and an individual social emotional toll that is devastating. So our service model differs from other regional clinical providers in that we support a higher ratio of indigent care than our for-profit peers. We do not turn people away for their inability to pay. We do not triage based on the amount of money we will receive for their care. And we do not limit the number of low-income patients we see each year. Children with Medicaid are treated on par with those who have private insurance or are self-pay. This is not true of for-profit clinics where Medicaid patients are either not accepted or relegated to the bottom of the wait list a lot of the time. We are also a community resource for educating historically underserved communities about what childhood developmental delays look like and how to access help for their children. We partner with state agencies, physicians, educators, service agencies, social workers, and early intervention specialists to ensure that those we serve have a comprehensiveness and quality of care that is unmatched elsewhere. And through our suite of services, the whole person is treated. This approach targets social and emotional development, fine and gross motor development, and cognitive skills, in addition to speech and language skills. Our mission work is primarily funded through revenue from our fee-based services. This includes third-party private insurance, Medicare and Medicaid, school-based contracts, and those manufacturers who partner with us for their OSHA-mandated hearing conservation programs. We also receive monetary support from the City of Chattanooga, private donors, and several local foundations. So how it works is that privately insured and private pay patients, as well as grants and donations, offset the costs of indigent care. There's a misconception I found that if you're a nonprofit, you provide services for free. What makes us a nonprofit is that our revenue is reinvested in the community. There aren't owners or shareholders who are profiting. A portion of every service or product purchase assists those who would otherwise not be able to afford therapy or hearing devices. And while we don't work for free, we do have a sliding fee scale for un or underinsured patients. It's based on the federal poverty guidelines, and depending on the service and the patient's household income, fees can be cut in half or less for qualified individuals. In terms of what we accomplish, to get kids kindergarten ready, we screen and or evaluate 2,500 children birth to 5 for potential disabilities annually. And we refer 100% of those children identified for appropriate intervention services or additional testing. Of those children birth to 5 receiving our therapeutic services, 85% will demonstrate continued progress towards their clinical goals, ultimately positively impacting kindergarten readiness and matriculation into the most appropriate classroom setting. And of those children birth to 5 receiving therapeutic services, 100% of parents or caregivers will receive early childhood resources and clinical homework for their children that will help prepare them for success in school. And on the other side of the coin, for healthy and connected older adults, 90% of the hundreds of older adults who will receive clinical care from our audiologists and are fitted with hearing devices will report a maintenance or increase in activity and or independence as a result of their amplification. So that brings us to 3 challenges we face. One is perception. While our nonprofit status is an asset to the community, we face the perception that our services are only for those in need or are of a lower quality. We have a best-in-class facility, equipment, and providers, and we don't work for free, as I said. We do accept private pay and private insurance patients. Those are things that people don't always know about us. Funding, as every nonprofit says, is another challenge we face. The costs of running a healthcare clinic have risen, as has the need for our services. We've seen the percentage of indigent care increase from 36% of patients in 2018 to 49% last year. While we need to subsidize more care, our insurance reimbursements haven't increased. For each Medicaid patient visit, we lose 1/3 of what the visit costs us. For the patients who qualify for our sliding fee discount, we lose at least 1/2 of what the visit costs us. All this subsidy results in us having to work harder than ever just to sustain. And the truth is, we're facing the uphill battle of making up a budget shortfall this year. The third challenge is a new landscape. Everything about the audiology industry has completely transformed over the past decade, from the diagnostic and treatment technology to patients' access and options. We're now competing against third-party insurance vendors, big box retailers, online sales, and soon over-the-counter devices. We've traditionally used our hearing aid sales revenue to help subsidize the cost of our mission work. And we now realize we must pivot to keep up with the rapid pace of change for that philanthropy model to survive. So I told you about our challenges, and now I'll tell you how you can help out. Spread the good word. Tell friends, family, and business associates. Take to social media. Grab people on the street. Whatever you want to do, tell them about us and our good work. Refer. Patients, manufacturers, and philanthropists. We're looking for audiology, speech, OT, and PT patients. Any manufacturers for their OSHA hearing conservation programs, and philanthropists to donate, volunteer, or serve on our board. Also, you can attend future fundraisers or volunteer with us and bring your friends. So that is all of my presentation today. I've put my email address here on this last slide. I won't be able to stick around and answer questions in the chat or do a later live Q&A, but I am happy to address any questions you have. Just shoot me a note and we'll talk.
That sounds great. Thank you so much, Taylor. And this is really amazing work that you all are being able to do in offering the physical therapy, the occupational therapy, the screenings that you're doing, and just recognizing to tag on to hearing and how important it is also vision, and having vision services for either children or for anyone to be able to see clearly, because without either of those, people do self-isolate, and that just leads to all kinds of health issues. So really appreciate you taking time to come and speak with us this afternoon. And hopefully y'all got, I will get your, if you will just put in the chat your contact information before you go, that would be great. So if people want to partner, volunteer, be on the board, be a patient, refer someone, that would be fabulous.
Thank you, guys.
Thank you.